Hi, my name is Dave, and I'm very excited to join you CNAs and licensed nurses today as we talk about and learn about the fundamentals of ADL documentation from a true expert in the field. Her name is Carol Mayer, and we are very lucky to have her as a member and as a resource here of the Service Center. We're going to sneak in on an in-service that she did at one of our facilities recently as she teaches the fundamentals and the specifics about daily documentation on all the ADLs that you CNAs and nurses do each day. So this is how it's going to go. We're going to fade in and out of the orientation that was held at a facility recently as Carol gives the specific instruction. She's going to start with the guidelines of that Medicare gives, and then she's going to go into the specific ADLs and give examples of the different types of documentation that's required for those ADLs. So look for something to take notes on, because there's going to be some tests along the way and at the end. And with that, let's jump into it.
What we're going to do is we're going to talk about what the Medicare rules are, because that's how we have to be documenting in the care tracker every day and in the nurse's notes. So what do the words that Medicare uses, what are they? The first word, whenever we're going to the kiosk and you're punching in an ADL, it asks you about the resident self-performance. It says, is the resident independent, supervision, limited assistance, extensive assistance, or total dependence? What the rule the government uses is that you are supposed to code the maximum level of help that the resident needed today, not the average or what they needed most of the time. So if almost all day they did everything by themselves, but one time you had to use your muscles, they want you to put that one time you used your muscles into the kiosk, the extensive assistance, because that's what they need to know. How many times, what's the maximum amount of help that the resident needed on each shift, and that's their rule. Okay, so when we're talking about the differences between independent supervision, limited, and extensive, always be thinking each day, what was the maximum amount of help that the resident got today? And that's what you're going to put in the kiosk, okay? If you code that the resident was independent, independent means the resident did it totally by themselves. You didn't have to touch them. You didn't have to check on them. You didn't have to remind them. You didn't have to cue them. As a matter of fact, you didn't have to come to work today. If they're independent, you didn't need to come to work today, and neither did anybody else. And there's really not too many residents who are in our facilities that nobody needed to come to work today. So when you go to put independent, you need to think about it. So how independent is independent? That's like when you go to lunch. When you go out to lunch, we don't sit at the nurse's station and worry about whether or not you can feed yourself, because you're independent with your eating. We might think, will you get back in time that I can go? Did you bring something to share? But not, we don't give a thought about, can you feed yourself? And for a resident to be coded as independent, they have to be that independent, that you didn't have to cue them, talk to them, remind them, check on them, or touch them today for that ADL. If they did it by themselves without you having to touch them, but you had to check on them or remind them, that's supervision. And take credit for that if you did that for that resident. We have residents that the physical therapist or the doctor says supervise their walking because maybe they're a little unsteady when they walk. And what do you think would happen if we would put that resident was independent with walking, even though we've been watching them, and then they fell down? Do you think we could be in trouble if we said they were independent? Yes, we could. So take credit for your work. If you watched the resident, checked the resident, used your eyes or your mouth, you reminded them, cued them, or checked on them, that is supervision. But once you touch them, we're past supervision. Remember, you always code the maximum. So if you've touched the resident, now we're past supervision. So then you have to choose between limited assistance and extensive assistance. So what's the difference? Limited assistance, in the government's word, is guided maneuvering of limbs. And the way they talk about it is the palm of your hand is down, you're guiding. If I'm going to take Kathy here and I'm going to help her get her gown on. And she's going to reach for the sleeve of the gown, and I'm just going to guide her hand in there. That is limited assistance. I touched her, but I just guided. She did all the work, okay? That is limited, palms down. But as soon as I turn my palm up and I'm lifting, we'll say Kathy had a stroke, or she's tired, or she doesn't understand what I need to happen. And if I pick her hand up and I put it in the sleeve, it's now extensive assistance, because now I have to use some of my muscles. And if I do this at all, if I have to use my muscles to help her even a little bit, it's extensive assistance. Okay? So extensive assistance is your palms up, you're doing some lifting or supporting of their weight. So you're using your muscles, palms down is just guiding. So then what's the difference between extensive and total? Extensive is, I am using my muscles, but she's doing some part of it. She's participating. So if I have to lift up this arm and put it in, but Kathy can put the other arm in the other sleeve, she's participating. So she's extensive, she's not total. Total means the resident the entire shift didn't participate at all. I think of it as they have to be totally total the total time. And so all day long, Kathy can't do anything. She can't lift up her arm, she can't lift up her foot. For me to dress her, she's just like this. And I have to do everything for her. That's total. So there's not going to be a lot of residents in your building who are totally total. Most of them are going to be more extensive than total. Total means they didn't participate. When it comes to Medicare, they wonder if a resident is total, they wonder why they're on therapy, because then it means they didn't participate at all. So usually, if we're trying to work with residents, they are at least doing something. You know, some residents we turn every 2 hours in bed, but when you go to turn them, if they even reach out to grab onto the side rail to help pull themselves over, even if they can't pull, they try. They're participating. They're extensives, they're not totals. Okay, so that's what I need you to think about. Your other choice on the care tracker is, did the activity occur? Activity did not occur, did occur. If it didn't happen at all, that's the only time you would do that. So if you have a resident who can't walk, when you go to code the ambulation, the walking, you would say the activity didn't occur today. It's different from total. Total means it happened, but I did it all. An activity did not occur means I didn't do it and they didn't do it. Okay. Then the next thing you have to be concerned about on the care tracker is the support provided. So when you're entering in the care tracker and you're saying the resident is either independent or supervision, then it's going to ask you, did you set something up or not? No setup or setup help. So what's setup help? Setup help is when you bring the resident something or hand them something so they can do the ADL. And the most common setup help that we think of is the tray. So for our residents who can feed themselves, if I bring them the tray and sit it down and open the lid and open the milk and cut everything up and walk away, because she's independent, she would be independent with setup help. Another example of setup help is bringing a wheelchair. Kathy might be able to get out of the bed by herself and transfer into the chair, but I had to bring her the chair, so I have to take credit for my work. I can't tell the government that Kathy could go somewhere and get the chair and then bring it back and get in it. All I can say is when I bring her the chair, she can get into the chair herself. So it could be either independent or supervision, but if I bring the chair, I take credit for that because I'm providing her something. It could be handing her a cane, it could be bringing her a tray. But I am providing something, handing something, and that's setup help. The tracker is going to ask you, was it one person or two or more that did the care? And this is really important. If anyone helped you even one time today, you need to take credit for the 2 people, because they want to pay us to have more than one person available for that resident. So it's important that we tell them if it takes 2 people. And we want to know, is this resident ready to go home or not with one person or 2? So it's important that we know. So if even one time someone helped you, put the 2. And the way the government's rules are written, it doesn't matter who the 2 people are.
Okay, great. So wow, there was a lot of information there that she covered. Let me just summarize it really quick and make sure that you have these definitions written down in your notes. First, there was independent. What I got from Carol there is that you really didn't even have to come to work today if someone was independent for that ADL. Next one was supervision. That means you're not touching the resident for that ADL, but you're simply reminding them, or you're cueing them, or checking in on them, just verbally, not actually touching them. Then there's limited assistance. And the rule of thumb there is that your palms are down, right? You're guiding their movement, but you're not really supporting them or helping them accomplish it in any way. What was the next one? Extensive. So extensive assistance is just the opposite, is that your palms are actually up. So if you're supporting their movement in any way to accomplish the goal of that activity of daily living, your palms are up, it means it's extensive assistance. And finally, there was total dependence. Total dependence to me just sounds like what it sounds like, which is the resident didn't participate at all in the accomplishment of that ADL. Let's see, there was a couple of other things she talked about. One was setup help. That's whenever you have to bring either the tray or a wheelchair or something else for them to accomplish the ADL. You take credit for that setup help. And the other one was the two people issue. If anybody, no matter if it was an employee at the facility or a family member or a doctor, if anybody during the day assisted you in whatever ADL it is, then you got to mark that it was a two-person assist. And it wasn't every time, if I got that right, it was any time during your shift. If somebody helped you with that ADL, it's a two-people assist. So make sure you got that set, and now she's going to go into the specifics of each and every ADL that we chart on every day. So let's go back to the in-service.
The first ADL that we're going to work with is bed mobility. And when we think of bed mobility, we think of how the resident rolls back and forth in bed. But it's more than that. It's how we pull them up in bed, but it also is how she gets from sitting on the edge of the bed to laying down, and laying down to sitting on the edge of the bed. So if I'm going to help Kathy lay down here after lunch, I want you to tell me how you would code this episode. Okay, are you ready to lay down, Kathy?
Yes.
Okay, here we go. Okay, how would I code that?
Extensive.
Extensive, how many people?
One.
One, exactly. If it's morning time and it's time for breakfast and Kathy needs pulled up for breakfast, would you mind helping me, Rusty?
Sure.
Okay, Rusty's going to help me this morning to get Kathy up in bed. Can you go on the other side?
Usually doctors don't help with this sort of thing, right?
But yeah. Well, it doesn't matter who the person is,
Oh, okay.
right? Okay. So we're going to pull you up for breakfast, Kathy. Can you push with your feet when we pull you up? Okay, here we go. 1, 2, 3, up. Okay. All right, how would we code that?
Two.
Extensive of 2. It's not total because she pushed with her feet, right? She participated, and there were 2 of us. So when you're doing your bed mobility charting, think about every person you pulled up for breakfast. And when you pull people up for breakfast, you don't do it by yourself, do you? No, you have helpers, right? So it's better for the resident's skin and your back. So if 2 of you pulled that resident up in bed for breakfast, when you go to do your charting in the afternoon, remember that with bed mobility. Thank you very much. So that's extensive of 2. Supervision with bed mobility would just be if I'm watching her. Maybe she has one of those mobility monitors on that just beeped. Okay, if I have to keep coming and checking on her, but I don't have to touch her, that would be what? I'm checking on her, but I'm not touching her. How would you go? Supervision. Yes. Okay, so supervision, I'm checking on her, but I'm not touching her. Limited assistance isn't going to happen very much. It might be if she goes to reach for a side rail and I just guide her hand. But there's not going to be much assistance, that's only guiding. So if I use my muscles, it's extensive. If she's somebody who can't push with her feet and she lays there like this and we have to pull her up and she can't push and she can't roll or anything, then she's total. Any questions with bed mobility? Okay, I think of it as everything that happens on the mattress. So that would even include when you're helping the nurse roll a resident over so she can change a dressing. So that's 2 of you helping a resident roll over. That's extensive of 2 for bed mobility. So even though it's just 1 time a day for wound care, you would still code that as extensive for bed mobility. All right, the next thing we're going to talk about is transfer. And transfer is how the resident gets from the bed to the chair, or the chair back to the bed, or a bed to a chair standing up, and standing up to sitting down. And if they fell down today, it's how we pick them up off the floor. So it's after she leaves the mattress. So if I'm going to help her get to the edge of the bed, are you ready to sit up, Kathy? That part is what, ADL? Extensive, but that's still part of bed mobility, right? But as soon as she leaves the mattress, now we're at transfer. So transfer is how she gets from the bed to the chair. So if Kathy's going to get out of bed to the chair by herself, she could be independent. But if I brought the wheelchair, it's setup help. But if she goes to get out of bed and I say, wait a minute, did you lock the brakes? Then what is it? Supervision, because I'm checking on her, even if she did remember to check, to lock the brakes. Okay, I want you to watch this and tell me how you would code this. Okay, Kathy, I want you to push up with your hands and stand up. Okay, walk over here to the chair. Get a hold of the handles and pull yourself all the way back to sit at the back of the chair. Sit down. That's it. How would I code that?
Limited of one.
Limited, why? My palms were down. I touched her, but I didn't use my muscles. She did it all, right? So now, if I just helped her get up like this, 1, 2, 3, and up we go, how would we code that?
Extensive.
Extensive. Very good. Now, Rusty, would you help me again?
Sure.
Okay. We're going to transfer Kathy into this wheelchair, and we're going to pivot transfer her. Okay, we're going to pretend she has a gait belt on. We're going to pretend we're doing it right, okay? And she's going to stand on her feet, and we're going to get her into this chair. Okay, Kathy, are you ready to transfer over there? So, Rusty, can you get a hold of her gait belt? Under her arm. Here we go. 1, 2, 3, over, down. Oh, okay.
That's called workers' comp.
So how would we code that? Is that total or is that extensive? Did Kathy do anything? Did she participate? She stood on her feet, right? A little bit. So she participated. So it's extensive of 2. It's extensive of 2. So what would be a total for transfer? The lift, right. Do you, if you have a Marissa lift or a Hoyer lift, they're totals. They pick the resident up, they take them over, they put them down. The resident's not doing any part. It's like a fireman's carry. If you're doing a fireman's carry, that 2 of you are picking up a resident and moving them and their feet aren't touching the ground, that's total. But if they're participating by having their feet on the ground, it's extensive. What would you call, do you have any sit-to-stand lifts? Do you call them Sierra lifts? Chorus lift, okay. If you have a chorus lift, would that be extensive, limited, or total? Is the resident participating if you have a chorus lift? Yes. They have to stand on their feet and they have to hold on, right? And it helps them to stand up. Even though you're moving it, it is still extensive because they're participating. If you're using a lift, do you usually have a helper with a Hoyer lift? You usually have 2 people, right? With a Hoyer lift, or you use Marissa. With Marissa lifts, you use 2. Then you would be coding total of 2 with Marissa. Okay, so if someone's helping you guide the resident to the chair from the bed, getting it all up there, then you would do total. If you, okay, the next ADL that we're going to talk about is toileting. And toileting includes not just when they're in the bathroom. You know, I think a lot of times we think that, but it's how they get on and off the toilet or bedpan, or if they're incontinent, how we clean up their pads and briefs, how they pull their clothes down, how they pull their clothes up, how they wipe, how we get them cleaned off. So if they're in bed and incontinent, that's still toileting. So it's important to take credit for that work. If you're saying the activity didn't occur, it looks like you didn't help clean them up today. So it's important that you think of all those things as toileting. If I have to help her stand up off the toilet or get down onto the toilet, I'm using my muscles, so how would that be coded? Extensive, right. So if the resident can put their feet down and then you have to transfer them from the wheelchair to the toilet, or you have to help them sit down or stand up off the toilet, that's extensive. You're using your muscles. If you have a resident that you have to put on the bedpan, you're rolling them back and forth, you're using your muscles. So how would you code that? Extensive. It also includes how you're cleaning them off. So if you have a resident who can get into the bathroom, but they need you to help them unzip their clothing, unsnap, pull their pants down, help them wipe out, and then help them get their pants back up, that's extensive. You're doing a lot of the work, and you're going to have to code it that way. If you have a resident that all you need to do is unsnap and unzip, and then they can go into the bathroom and go themselves, and they come out and they can't get snapped, that's limited. You're just touching them. You're not using your muscles to do the work. And so that's about the only way it's limited. So anybody who's incontinent in the bed, and you're going to change them, roll them back and forth, take off the dirty brief, clean them up and put a new one on, that's at least extensive. And it could even be total if they don't help you at all. And if someone else helps you do that, then it's extensive of 2 or total of 2. So take credit for all that work. And that, I know that that's a lot of work with the residents, so we need to take credit for that. So don't just think about the bathroom. It's the same with a colostomy. If they have a colostomy and you have to empty that, that's a lot of work. So that's extensive, at least. Could even be total if they don't help at all. Same with emptying catheters and doing catheter care. All that's part of total if they don't. We spend a lot of time with the residents and eating. A resident who's independent, independent with their eating is someone that I could set up the tray, get everything all cut up and walk away, and she can feed herself. That's independent. If I have to encourage her to eat because she is losing weight, or if I have to watch her because she's someone that I have to make sure she takes tiny bites and takes a drink in between, that's supervision. So if I have to cue her, remind her, or check on her. Now I know every resident, we write down how much they eat, but if it isn't that we're checking on them during the meal to make sure that they're okay or that they're eating enough, then they're independent. But if we are encouraging or checking on them for a reason, then that's supervision, okay? Limited assistance is guiding. What would you call this? All right, so Kathy has fed herself. We'll say she ate half of the meal. And I come in and I know she's been losing a lot of weight. And I'm going to say, Kathy, can you try a little more of the beans? Can you try a little bit of the cake? Yeah, okay. All right, and I give her one bite of the cake. Now what am I going to call her eating? Extensive. Even if she ate the rest of the meal all by herself, because when I did this part of it, this part was total. And since it's not total the whole shift, just part of the shift, I have to code her as extensive. So even if some residents you'll have that you have to give them 1 or 2 bites and then they can feed themselves, and other residents you'll have that you have to kind of finish up a little bit, that's all extensive. Limited assistance would not be this because I'm using my muscles to do that. Limited assistance would only be if Kathy was going to feed herself and she goes to reach for the plate and I'm saying, over here's the cake and over here's the sandwich, and she's reaching and I just guide. That's limited. Limit is not going to happen much. If all she's doing is chewing and swallowing and I have to feed her the whole meal and she can't hold onto a cup, she's total. Okay? But if she can even hold on to a cup or hold on to a spoon or hold on to a fork, she's participating. And so that is not total anymore, that's extensive. And this is ADL of eating is how they get food and drink and fluid into them. So what about a tube-fed resident? If Kathy didn't get a tray and she's totally tube-fed, what would you code for eating? Total. Because the nurses have to totally do the tube feeding for the resident. What if Kathy got a tube feeding and she got a tray? Do you have any residents who also get a tray, right? So if Kathy's tube fed and she has a tray and she can maybe drink a little bit by herself, now what am I going to code her eating? Totally, she's tube fed and she gets a tray and she can drink a little bit by herself. What would I call it? This is a tricky one.
Extensive?
Extensive because she's totally total part of the time, not the whole time, so it can't be total, so it's extensive. The same with an IV. If she has an IV running, that's totally done by the nurse. But if they have an IV in them and they get a tray and they can eat anything off the tray by themselves, they're extensive, they're not total. But you have to take the IV into consideration. Even if she can feed herself all by herself, if she also has an IV running, she's extensive for eating on that shift. Okay? Any questions about that? So 1 or 2 bites is extensive. Even 1 bite makes the meal extensive. And what if this afternoon, maybe she fed herself all day, but this afternoon when she's in bed, she's like, can I have a drink? And I take her water and I put a straw in it. And I just put the straw up and she sips out of the straw. Okay, she took a hold of it. All right, so now what would I code that? Huh? Supervision and setup help. But if she wouldn't help me, if I would just pick up the cup with the straw and she just sipped out of the straw without helping me, and then I set it back down, what's that? Extensive, because actually this act would have been total, but since she ate the rest of the meals independently, can't be total, so today she's extensive. Right? So you have to think about the whole day before you're going to decide how you're going to list. The next one that we're going to talk about is walking. And when you go to the care tracker, there's 2. One says walking in the room and one says walking in the hallway. So what's their room? The room is their bedroom and the bathroom inside of their room. The hallway is the hallway right outside of their room. If they walk anywhere else, it doesn't count. Okay? So if Kathy's independent with walking, she just gets up and walks, and I don't even notice, except I see she's different places. She's independent. It's like you all. You all just walk around. You don't worry about it. But if she's somebody who gets unsteady sometimes when she walks, or maybe she's somebody who goes places she's not supposed to, and you have to keep an eye on, then you're supervising her walking. If she walks with me, and I hold her hand, how would I code that? Limited. I'm touching her, but I'm just guiding. Or even if I had my hand on her back and I guided her around, is limited. But if I had her by the arm, I now have some of her weight, and now it's extensive. Okay? And it can be 1 person or 2 if someone's on the other side. Can you have total for walking? The answer is no. You can't have total for walking because if the resident's not participating, then that's the only way that it's total. So if you're saying it's total for walking, it means you're dragging them down the hall. That always kind of makes me nervous when I'm seeing that. So think about it. And you could have that they walk in the room and they don't walk in the hallway. And some residents just walk in the hallway and they don't walk in the room. So you have to make a decision for each place. But if the only place that this resident walks is in the physical therapy department, they're not walking in the room and they're not walking in the hallway. And you'd say walking did not occur in those 2 work. All right, and then the next one is locomotion. And this one is confusing. All right, so locomotion includes how the resident wheels and how they walk. A resident who never uses a wheelchair, their locomotion is walking. So if people who are walking around, the residents who never use a wheelchair, they walk from place to place. Their locomotion and their ambulation are exactly the same. If they use a wheelchair, the government says it's after they're in the chair. That's when locomotion starts, when they take off, because how they get into the chair is transfer. So you can even use a Hoyer lift to put them in the chair, but once they're in the chair, if they can go by themselves, they could be independent. But you always code the maximum amount. So if Kathy can get around in the wheelchair all by herself in the room, she's independent. If she's somebody who runs into things or goes places she shouldn't, maybe I have to watch her, that's supervision. But if it's time for breakfast, and she's slow, and I say, Kathy, lift up your feet, I'm going to push you down the hall, now how would I code her locomotion? Extensive, right. Because I had to use my muscles, okay? If Kathy never makes her wheelchair go by herself, then she would be total because she wasn't participating. But if she can even do it a little bit, then it's extensive. What if Kathy uses a wheelchair independently, but to get from the wheelchair to the bed or the wheelchair to the bathroom, I lock the wheelchair and I walk her and I use my muscles to walk her.
Extensive.
Now she's extensive for locomotion, even though she's independent in the wheelchair. Because remember, you always code the maximum. So you look at their walking and you look at their wheeling. Whichever one needed the most help, that's what you put in the care tracker. Okay, if locomotion says on the unit and off the unit. On the unit means in the resident's bedroom, their bathroom, and the hallway outside their room. Off the unit means the other hallway, if there's another hallway, the other floor. It also means the dining room, the activity room, and the physical therapy room. They're all considered off the unit. When the government wrote their rule book, they didn't know how the nursing home was built, so they just made the rules that the activity rooms, dining rooms, and physical therapy rooms are off the unit. So if the resident goes there, then how are they locomoting when they're in that area? Okay, the next one is dressing, and dressing is how the resident puts on and takes off street clothing. It's how they put on and take off hospital gowns, nightgowns, pajamas. If they have a prosthesis, how we get one of those off and on. So if Kathy gets up and gets dressed all by herself, she's independent with dressing. If we have to put the dirty clothes into the hamper and we have to get the clean clothes out, or else she put the same dirty ones on, then we're supervising her dressing. And you also have some residents, you hand one thing at a time. So if you put this on, then put that on. That's supervision if you're not touching them. But limited is just guiding, and that's when she did the reaching and I did the guiding. The other thing would just be if all I had to do was unbutton, unsnap, or just untie. Okay? If I untie, that's limited. But then if I had to help her by picking up her arm and pulling the gown off, it's now extensive, right? So we have some residents who can dress themselves, except they can't get their shoes and socks on. If you have to pick up a foot and put a sock on it, it's extensive. You put slippers on so somebody can go to the bathroom. You're lifting up their foot. It's extensive. Even if they button, snap, zip, totally dress themselves, if you help them with their shoes and socks, it's extensive. The next one, and we're almost there, is personal hygiene. And personal hygiene is their AM and PM care, washing their face, hands, and bottoms. And it also is brushing their teeth or dentures, combing their hair, putting on makeup if they put on makeup, and shaving if they need shaved. If you do one of those subtasks totally, and they can do the rest of them, you code them as extensive. So if Kathy can wash her face and hands, but I have to wash her bottom, she's extensive. If she can wash herself, but I just brush her dentures and hand them to her, she's extensive because I totally brushed her teeth. If she can wash her hands and face and she can brush her teeth, but I comb her hair, she's extensive. If she can do all of that, but I have to shave her today, it's extensive. You know, so you have to look at that. If I had to do every one of those things and she didn't participate, then she's total. Okay, so limited isn't going to happen much because it's guiding. So if I just do a little bit, if all I did was her teeth, it's extensive, it's not limited. Limited is guiding. So that might be when I bring the basin and the water that I just show her as she reaches out and I'll say, over here's the towel, here's the water, and over here's the soap. That's limited. But if I have to do anything, it's extensive. It's total if I do everything and she just lays there and doesn't even lift up an arm to make it easy for me. Then it's puts on and takes off. The last one, the last ADL is bathing, and bathing is coded a little differently when you go to the care tracker. The choices are, were they independent or were they supervision, which is the same thing. It means you didn't touch them. You either reminded them to go or you reminded them to wash a body part, then it's supervision. Then it says, did you help transfer them? And that means that you have to get them into the bathtub, out of the bathtub, onto the shower chair, out of the shower chair. That would be help and transfer. Then the next choice is, did you help in part of bathing? And that means, did you wash a body part? Now, their hair and their back don't count. The government says in every nursing home in the country, every resident needs help with their hair and their back. So that's free. So if the only thing you did for this resident is wash their back and wash their hair, you would not say you helped in part of bathing. Then you would say, did I help them transfer? If not, then it's just supervision. But if you wash their toes or their belly or any other body part, then you would say help in part of bathing. Then last choice is total, which means the resident didn't do anything. You put them in the tub, you scrubbed them up, they didn't even lift up an arm to help you, you got them back out, they didn't help. That's a total. But if they did anything to help participate, then it's extensive and not total. It's help in part of bathing and not total. And I know that's not an ADL, but just one thing about incontinence. When you're coding the bladder incontinence and the bowel incontinence, the manual says if any part of their skin gets wet, it's considered incontinent. So if you have a resident who, as they're going to the bathroom, they dribble in their underwear, and then they go into the toilet and they pull down their pants and they can void in the toilet, they would be continent in the toilet, but they'd also be incontinent in their clothing, and so, or on their pad or whatever they had. So you would have to mark it both continent and incontinent. If they're totally continent, you didn't have to change, they didn't get wet at all, they're incontinent. If they wear a pad or a brief and everything goes in there and they don't use the toilet successfully, then they're incontinent today. The same with if the Foley catheter in, if the Foley doesn't leak, they're continent. If the Foley does leak today, it would be considered incontinent. If they have a colostomy and the bowel movement comes out in the bag, they're continent. If they have a colostomy and it oozes out around the wafer, their skin gets dirty, that's all considered off the...
Okay, so there was a lot of information that Carol just shared with us. She covered examples of different levels of assistance in every ADL, and I think that you probably feel pretty confident now with your ability to recognize how to code the different levels appropriately. So what we're going to do right now is take a little test. I'm going to put up on the screen some questions. I'll give you some time to think about it. This is a group test, so you can talk with the other nursing staff there in your room, and let's see how well we do. Alright, and let's start with the 7 to 3 shift bed mobility, where Mr. Stapley needed 2 staff to lift him up in bed. He was able to bend his knees and help push up with his feet. What would that be? How would you code that scenario? That's extensive, with 2 people assisting him. Very good. Now let's move on to eating. Mr. Stapley can feed himself once you cut up his food, but he's extremely slow and takes very small bites. You must feed him the remaining 2/3 of his meal so he can get his nourishment. That independent supervision, what is that? That's also extensive. This time with 1 person assist. Alright, very good. Now we're going to be moving on to transfers. Still in the same shift, Mr. Stapley cannot always transfer by himself. Today on your shift, he needed heavy weight bearing assistance of 2 staff in the morning, and after lunch he got into bed by himself. What's that? Extensive, with 2-person assist. Now let's take a look at toileting. Mr. Stapley was able to transfer independently from the chair to the toilet, but you had to unzip his pants and pull them down. After toileting, you had to pull his pants back up and zip them. Is that extensive or limited? What is that? Extensive again, this time with 1-person assistance. Now bed mobility. Next shift, 3 to 11. Mr. Stapley tells you and another nurse aide how he wants to be positioned. You and a partner position him and make him comfortable because he can't move on his own. He only participates by telling you how he wants to be positioned. Is that total? That's right. 2-person assist, and it's total because he didn't help at all in the ADL. This time on a transfer, Mr. Stapley required a mechanical lift, and 2 nursing assistants operated the lift due to safety and following facility policy. Based on that, is that extensive or total? What do you think? It's total. It doesn't indicate at all that Mr. Stapley participated in the transfer. Now toileting. Mr. Stapley is incontinent of bowel and bladder. He is unable to use the bathroom or a bedpan. 2 nurse aides roll him back and forth in bed, remove his soiled brief, cleanse him, replace his brief, and readjust his clothing. What do you think? Total. 2-person assist. Very good. Back to eating. Mr. Stapley now has a tube feeding and does not drink or take any food by mouth. What did Carol teach about tube feeding? Can you remember? Is that limited? Is that total? Yeah, it's total. 1-person assist. This time let's look at bed mobility. Mr. Stapley is an Alzheimer's patient. We're now on the night shift. Frequently attempts to get up from bed at night, setting off his personal alarm. After the staff provides assistance to the toilet, he receives frequent cues and reminders to turn and position himself in bed. What's that? Supervision. No touching in bed, just verbal cues. Very good. Still on the night shift, Mr. Stapley, when he's getting up from bed, one staff member positions his walker next to the bed. He then transfers, comes up to a standing position with the staff member placing her hand on his arm for guidance while providing verbal encouragement. The hands-on guidance is required due to Mr. Stapley's unsteady balance. What do you think? Limited. One person assist. Just guidance, but not weight bearing. Very good. Toileting. Mr. Stapley is able to walk to the toilet with assistance of one staff. He was able to sit down on the toilet independently, but a staff member had to help him by placing their hand over his, to pull down his pajama bottoms, hand him a face cloth, to wash his hands and assist him, touching and verbal, to readjust his clothing. A lot going on. What is it? Limited, with one person assist. Very good. Now let's do the last one. It's eating. Mr. Stapley is encouraged to eat a snack and drink a glass of milk throughout the night. The nursing assistant must place one item at a time in front of Mr. Stapley. First his crackers, then his milk, and with verbal encouragement, Mr. Stapley eats his snack and drinks his milk. What do you think? Supervision with setup support. You guys did great. Good job.